Physical therapists get soldiers back onto their feet, and a local hospital cleans up its training. This is the Regional Health Report. Welcome to the Regional Health Report for February. I'm Ann Krebs. Winn Army Community Hospital looks at ways to standardize lower back pain treatment. Which is preferred, radiologic imagery or early access to physical therapy? Zach Renstrom brings us the story.
The committed staff at Winn Army Community Hospital has spent the last 3 years developing a multidisciplinary approach to musculoskeletal lower back pain treatment.
We've worked closely with health benefits and the physical therapy department and all the providers here at Winn Army Community Hospital outlying clinics to institute a education program to educate providers on a new policy, a new guideline for treating low back pain.
The purpose of the new guidelines is to standardize care and prevent waste of resources, utilizing physical therapists from the Department of Rehabilitation to diagnose and treat lower back pain before using radiographic and magnetic resonance imaging.
The results the patients got after these tests were actually worse than the improvement they saw when they were treated on the basis of their symptoms without any imaging. So the patients did better with a non-imaging approach than they did when they got imaging with the initial onset of pain.
In early 2013, a multidisciplinary team began working on the implementation of robust process improvements to treatment plans involving lower back pain.
It really is a team effort to try to institute a better care guideline for our soldiers. We couldn't do it ourselves.
My part is gathering the data from the systems that are available and sharing that data. Also communicating with all the clinic leadership on when we had an improvement so that they knew we're doing the right things to improve our patients' care.
In mid-2014, a physical therapist was embedded at Hawks Troop Medical Clinic, which provides direct access for the patient to the PT program. The program started as a pilot to address acute musculoskeletal injuries and now is featured at the Richmond Hill Medical Home and Tuttle Army Health Clinic.
So the soldiers had, again, early access to physical therapy. That treatment got them back to the front lines much quicker than having to wait for radiology and then starting PT. I think that really impacted our readiness.
As a result of the multidisciplinary process, the HEDIS measurement for lower back pain increased from 10 to the 90 percentile in a 28-month time frame, ensuring Winn's continued commitment to delivering the highest quality health care. For the Regional Health Report, I'm Zach Renstrom.
Winn Army Community Hospital was recognized with the DoD's Advancement Towards High Reliability in Healthcare Award for the collaborative development and implementation of standardized treatment procedures for lower back musculoskeletal pain. Next, industry experts gather at Kimbrough Ambulatory Care Center to observe and share best practices during a disinfection and sterile processing workshop. We discover what is learned during this Train the Trainer course.
We've been learning about high-level disinfection and the sterile processing department. Those are two areas that are very critical within military treatment facilities, and we've brought approximately 12 students, and we're actually auditing these areas, looking at the reprocessing, looking at the process steps, actually examining each of these critical areas to see what we can do to improve and to see, hey, this is what you're doing right.
When an instrument is transported, what should it be? How should it be kept?
Moist.
Moist, because we want to keep it moist during transport.
These instruments, particularly endoscopes, are extremely complex and they're very, very difficult to clean and to disinfect.
Wash the scope off with this and rinse it. Put the scope in here.
After we decontaminate something, we assemble it, we sterilize it, and this is the area where we store it so that we can then distribute it to the procedures that require it. This is a very important room, and to make sure that all the stuff in here are safeguarded is important for patient safety and patient care.
If I could do it again, I would. So I feel like any kind of knowledge that you could always get to better your organization is always definitely a plus.
They've said, oh my gosh, I cannot wait to get back to my duty station. I see some things that we could do better. Or I've also heard like, oh my gosh, we're doing that. I'm so glad. I can't wait to share that with the members in my duty section to say, you know, way to go. We're really doing some good stuff. Our patients deserve the absolute best. And this workshop really is centered on patients making sure that they're getting the absolute best.
In other news around the region, volunteers at Blanchfield Army Community Hospital donate quilts to new moms. It's a chance for moms to get something personal from the community. The volunteers give their time, effort, and supplies for each baby born there. One local quilter, Lyle Tomlinson, began quilting blankets after retiring more than 20 years ago.
First of all, I enjoy sewing. I have to find an outlet for my sewing, and I enjoy doing this. And I wanted to do something to pay back Fort Campbell.
That's the Regional Health Report. Join us next month for another show highlighting health care across the region. Later this month, the Regional Health Report will be on iTunes and Google Play. Check out our Facebook and Twitter pages for the announcement. Thanks for joining us.